Dear friends, welcome to another coaching session by MSD Animal Health. And today it is my pleasure to have an exclusive guest here. Her name is Dr. Talita Resende from the Ohio State University, and she's an assistant professor in the swine department there. Talita, welcome. Thank you for being here. And first of all, introduce yourself to the audience.
Thank you very much for having me here. It's a pleasure to give this interview and to be here for the event. So yes, my name is Talita Resende. I am currently an assistant professor at the Department of Animal Science at the Ohio State University. And I just started there last May, so I'm kind of brand new to the university, still learning my path there. And from now on, my appointment will be mostly dedicated to swine extension. I'll do a little bit of research, but 80% of my activities need to be related to swine health extension, which is good because this is an area that I like very much. I got my DVM and master's degree from Brazil, where I got into this world of swine production, swine health and production, with the guidance of Dr. Roberto Guedes. And after master's, I went to Minnesota, to the University of Minnesota for my PhD. After that, there I went back to Brazil, worked in the industry for a couple of years, but I was missing academia. So I had this short experience at the Universidade Federal de Juiz de Fora. But it was pretty much at the same time that I was applying for the job position here at the Ohio State University. And they selected me here, so here I am.
Very nice, great. So I agree, swine industry is a good place to be, either industry or academia. And so at the university and in your CV, what is your main focus? And I think having worked in the beginning with Roberto Guedes, a bit led the path, right?
Yes.
But what is your main topic of interest?
Oh, that's correct. I mentioned Dr. Guedes, but I cannot forget to talk about Dr. Connie Gebhardt and Dr. Fabio Vanucci. They were my advisors during my PhD, and both during master's and PhD I was working with Lawsonia. Different areas for, in master's and PhD, but still this is an area that I'm very passionate about. And if possible, I would like to dedicate some of my time in research into Ileitis, if I'm allowed it. But as I mentioned, I'm also passionate about swine health in general. So if not possible to continue in Ileitis research, I'll probably do something else, and I'll be very happy with it too.
No, that's great. And looking at intestinal health and Ileitis, and I want to stick to the scientific part in the beginning of it. There's one big challenge, and actually my scientific work was related to Mycoplasma, and Mycoplasma and Lawsonia share the difficulty in culturing, etc.
Yes.
And this also makes it difficult to work on pathogenesis and understanding the mode of action of the pathogen. So what are your thoughts on that, and have you any insights on how we can address this, or maybe news how it works?
This is a very important question, and actually I dedicated my PhD thesis to investigate a little bit about pathogenesis of Lawsonia intracellular infection. We did some cell cultures to use them to see if they would replicate the cellular proliferation we see in vivo. Although they are very permissive to Lawsonia growth, the type of cells we tested, they do not proliferate as we see it happening in vivo. So we went to the enteroid area, and they are fascinating, and they mimic the intestinal epithelium very well. It was in the end of my PhD when we started working with enteroids. We did a little bit of mouse enteroids. Interesting results, however, not that promising, but we reached the point where we had the swine enteroids developed, so we could infect them with Lawsonia. And although very preliminary, they do seem very likely to be a good model to understand pathogenesis.
So those are basically, to simplify, could we say those are like artificial cells?
Well, I wouldn't say totally artificial, because to have the first, I would say the primary culture of enteroids, you need to have a sample from a pig intestine. But after you have the culture going on, you can kind of replicate them in vitro. So you don't need to euthanize an animal every time you need a new enteroid culture.
Okay.
So yes, it's natural, but at the same time it's in vitro, but which is good, because then we don't need to, have a lot of animals for research. It helps us a lot in that area.
Yeah, important point. That really helps a lot. That's very interesting, and I'm really looking forward to see what comes out of that. And again, this is more for the scientific community right now, but the swine industry is facing Ileitis and Lawsonia infection as a problem in the animal in the barn right now. And can you briefly summarize what Lawsonia is doing there? What is the impact and the harm that is done by that pathogen?
Well, I'm going to start from the very beginning, so people understand why is it still very unknown for everybody. Ileitis, or at that time adenomatosis or adenoma, was first described in pigs in the 1930s, which means that it's kind of a new disease comparing to infections by E. coli or by Salmonella. And Lawsonia was truly identified as a bacterial species only in 1993, which means just a couple of years ago, again, in comparison to other pathogens.
That's not long, yes.
Yeah, so it's kind of new, and there are still a lot of unknowns. What we know is that Lawsonia goes into the intestine, especially the ileum, and this is why we call the disease Ileitis, but it also infects other parts of the intestine, even a little bit of jejunum, cecum, colon, and sometimes even rectum, more rarely though. And Lawsonia goes there, leads to epithelial proliferation. Nobody knows exactly how, but this kind of proliferation in consequence leads to decreased numbers of goblet cells that produce mucin. It's already proven that the infection also decreased the expression of some important enzymes. So it doesn't matter exactly how or what are the molecular mechanisms right now, but what we do know is that intestines affected by Ileitis, they don't perform well. And with that, the pigs don't perform well.
Absolutely. And when you say the pigs do not perform well, how do we see that in the farm, in real life? Is it really diarrhea and that's it? Or
this is what most people still believe. Like, I don't have diarrhea here in my farm, it's fine, my pigs don't have Ileitis, but it can be true, but in most of cases it's not true. Because if you do the correct diagnostic tests in correct time points, you're going to see that even pigs that are not showing diarrhea, they can be infected. And as long as they are infected, their intestine is disturbed, and they are not gaining the weight that they could be gaining. So it's not that they might not be losing weight, but they are not gaining the weight that they were supposed to gain. So a good way to measure that is feed conversion rate and also the average daily weight gain. Those numbers are really nice to see how the profit can be better or worse depending on the Ileitis conditions in the herd.
Yeah, of course. So basically Ileitis or Lawsonia is eating the profit because it holds the pig back from its potential. And capturing average daily gain and capturing feed conversion ratio is a challenge sometimes in farms. You need to measure the food consumption, you need to weigh the pigs at certain points in their life. But I get from what you're saying that you think that this is worthwhile to get an idea of the impact.
I am sure about that. I understand it's difficult. Those numbers, these kind of numbers are not easy to measure, as you just mentioned, but I think it's worth to try and to see the performance of some lots. If you're trying to introduce vaccination, you can compare historic numbers with previous lots without vaccination and start vaccinating and see the differences. Or you can do cohort groups and see how they perform together. Those would be also good ways to do it without having to calculate the exact amount of weight they are gaining every day. Just growing them together with or without vaccination, or measuring or doing PCRs in one group and, trying to monitor the herds and see the amount of Lawsonia that's circulating there.
Yeah, makes sense. So important point is to get an idea of what is going on. And what adds to this is, I think, to be aware of the risk, let's say. And with risk, I mean the prevalence of the disease. Do you have numbers? Do you have ideas about the prevalence in Latin America specifically?
Well, I would say that I was a little bit surprised when I was looking up some numbers, because we do have numbers for Brazil. I did find numbers for Argentina, but for other Latin American countries, it's very difficult to find in the scientific literature. So please, if you have data, share with us, because it's difficult to find. But yes, in Brazil, we know that seroprevalence in many herds, many states, is around 90 to 100%. And by data from cross-sectional studies with PCRs, around 40% of herds were positive at the moment of the study, which means that Lawsonia is there and might not be correctly diagnosed. And just to go deeper a little bit in that, because I like this example, for my master's dissertation, we collected samples from 30 farms in Minas Gerais. At that time,
which is in Brazil, sorry.
It's in the southeast Brazil, very close to São Paulo and Rio. It's the 4th state in swine production in Brazil. At that time, it was around 2012-ish to 2011. None of the 30 farms we visited was vaccinated against Lawsonia. Managers, producers, they answered some surveys, and they said, no, I don't have Ileitis in my farm. I don't care about it. Guess what? All of them were seropositive, which means probably the pigs were subclinically positive. They didn't know about it. They didn't think this could be a problem, but they were probably losing some profits there. And I imagine this is the reality for many herds that don't monitor for the disease.
Yeah, for sure. And especially now in a situation where feed prices are much higher than they used to be in 2012. And there's a direct relation. So when Lawsonia eats your food, or the feed, and the feed costs a lot, so
it makes sense to monitor, right?
Exactly. Yeah, I fully agree. And it's interesting. So we have pretty recent seroprevalence data, or also PCR prevalence data from Europe, and depending on country, also lay between 90 and 100%, and on farm level, it's also close to 90%. So it's high. It's high. And it's a real issue for the industry that many people are not aware of.
Yeah, I totally agree.
That's fully clear. And so this means when we agree and we know that it is a very widespread issue, how should we think about control? You already mentioned vaccination, but it's not the only way to do it.
Well, some studies have shown that antimicrobials are still very effective against Lawsonia, especially carbadox, tylosine, thiamulin. But we should not rely just on them, because we know there is this global trend of decreasing or optimizing the use of antimicrobials. We are lucky that Lawsonia is not resistant yet, but we should be paying attention to that. But unfortunately, we don't have other great alternatives, or actually fortunately, because cleaning and disinfecting works very well to decrease the pressure of infection in the farms. So if we do the basics very well, it's going to help either vaccination or control by drugs.
Yeah, that's an important point, and that is true for almost every disease, right?
Viral, bacterial diseases.
Even if I have a very efficacious and good vaccination, for example, if I disregard the basics, the effect will be less.
Exactly, including biosecurity that I forgot to mention.
Yeah. Absolutely, I think that's absolutely true. Now, when we talk about the vaccines, what role do you think do they play and can they play in the control?
Vaccines have been proven to be very effective controlling the disease, not by decreasing the clinical signs or the severity of clinical signs, but also by decreasing the intestinal lesions that I mentioned in the beginning. They are the primary reason why the pigs are not performing well. But besides decreasing all the clinical signs and all the intestinal disturbance that happens during the infection, vaccination is also proven to decrease the fecal shedding of Lawsonia intracellularis. By decreasing fecal shedding, you are very likely to decrease again the pressure of infection in the herd, which means that less pigs, over time, if you keep vaccinating, less pigs will get the disease, and over time, your herd is going to reach very good point, health point regarding Ileitis.
Yeah, especially because we know that the severity of lesions is correlated with the bacterial load in the gut. So that's an important point. Absolutely. So we've been talking about monitoring performance values. We've been talking about control, treatments versus and vaccination. Maybe some thoughts, and it could have been before, but but some thoughts on diagnostic. What do you think is a good diagnostic approach to know what is going on in the farms? Is it serology? Is it PCR? Culture, not so much, but
yeah, just to reinforce, don't call the labs asking for Lawsonia culture, because it's not very likely to happen in the routine. This is why we have just a few isolates around the world. It's very difficult. I've been trying when I was in master's and PhD. No, it's not a good experience. Anyways, diagnostic-wise, I believe that the combination of the methods is the best option for it. Of course, if you have a dead pig, or if you have, the opportunity to have some pigs euthanized, it's very good to have gross lesions measured, or evaluation of the intestinal wall, along with histopathology and immunohistochemistry. Immunohistochemistry is still the gold standard for diagnosing Lawsonia intracellularis. However, we understand that postmortem is not very feasible in the routine, and we don't want to go around and just euthanize pigs for that. So what we can do and what we should do is try to combine serology with PCR, especially real-time PCR. Serology is very good to establish the serological profile in the herd, to know when the maternal antibodies are decreasing, when the pigs are actually being infected, and see kind of the duration of this immune response. But if you are already vaccinating your pigs, serology only is not going to work very well. So you can combine serology, see the vaccine response in IgG levels, combining with real-time PCR, because you just mentioned, and it's a very good tool because we know that it's proportional. The higher the amount of Lawsonia intracellularis in feces, higher the intestinal lesions and worse will be the pig performance.
Yeah.
So combining those two methods is the way to go for ante-mortem diagnosis.
Yeah. Thank you. And that's, I think, for someone in the field, in practice, this is already a very nice package of information that you gave, going from what does the pathogen do, the pathogenesis as far as we understand that, over monitoring, getting an idea if I have a problem, diagnosing the problem, and then how to control it.
Exactly.
So that's great. I really enjoyed talking to you. Thank you, Talita, for being with us.
Thank you very much for your nice questions. As you could notice, I'm kind of passionate about the theme.
Yeah.
But I totally understand that this passion is not the same as the producer's passion.
I know that.
Because we want pigs to perform well.
That's true.
That's the point.
That's true. I always say in these, and I mostly say it about PERS, that I am two persons when it comes to that. The scientist loves it, the veterinarian hates it.
That translates my situation here
exactly.
for Los Angeles.
That's what I feel, and that passion, I really appreciate it. So thank you for this interesting talk, and I'm looking forward to your presentation in the event tomorrow. And everybody, this concludes this coaching session by MSD Animal Health. Thank you for watching, and be sure to be around for the next one with another interesting guest. And thanks again, and take care.